In my clinical rotation this semester, I had the opportunity to observe many instances of skin-to-skin practiced by moms and their new babies. And so when I was observing a couple of vaginal births, I noticed the nurse would ask the mom prior to delivery if she wanted to practice skin-to-skin when the baby was born. And every time the nurse asked, I always saw the mom say yes, that she wanted to do that. And so after the baby was born and dried off, the infant was placed just in a diaper on the mom's bare chest with a little blanket over both of them. And when I observed a couple of cesarean births, I also saw that skin-to-skin contact was practiced as much as possible for the circumstances. When I was in the neonatal intensive care unit, I also saw a mom come in and we helped her get her little baby out of the isolette so that she could do skin-to-skin contact with her 1-week-old premature infant. And in all of these instances of skin-to-skin contact I observed, I just love the closeness between moms and their babies and the sense of tranquility that was there. And so I wanted to learn more about any evidence-based benefits that might come from skin-to-skin contact and also how it can best be practiced. So I learned that skin-to-skin contact is also known as kangaroo care, and it is practiced throughout the world. It's practiced in places like Uganda and the United Kingdom and Colombia and here in the United States as well. And so it involves, after the baby is born, drying off the infant and placing the infant just in a diaper, sometimes even without a diaper, directly on the mother's bare chest. And oftentimes they are covered with a blanket. And this is often done pretty soon after birth, and then up until the infant has its first breastfeeding. And this can be practiced for all moms and all babies and after any birth method. So it can be for preterm infants or term infants. And also some cares that are non-urgent, such as eye care and screening tests, can be delayed to allow time for this skin-to-skin contact. And APGAR scoring and vital signs for the infant can be performed while the infant is right there, skin-to-skin, on the mother's chest. So I had the opportunity to do some research to learn more about the benefits and the best ways to practice skin-to-skin care. And so first I found a systematic review from the Cochrane database that talked about healthy infants and how skin-to-skin benefits both the mothers and their healthy infants. And then I had the chance to research on Signal and Medline and look at peer-reviewed articles in the last 5 years. And there were a lot of amazing articles. And so there were a couple I chose to focus on just more for background information because they had information that was awesome, but also went beyond what I wanted to focus on for this practice analysis. And then, so the first one I found was about a program in Uganda that they initiated in hospitals to help nurses to help new moms practice more skin-to-skin contact. And that was really cool to read about, but because it focused more on the program for nurses, I just used the article for background information. And then there was another article that talked about skin-to-skin practices in Zambia and the United Kingdom and Rwanda, so places all over the world, and some barriers to practicing skin-to-skin, such as staffing and training, and how those can be overcome. So that was really helpful, also again for background information. And then I found a randomized clinical trial that talked about the difference between early and immediate skin-to-skin contact on breastfeeding rates, exclusively breastfeeding rates, and how it affected breastfeeding. So, talking about the time of initiation of skin-to-skin contact, the randomized clinical trial defined early skin-to-skin contact as being within or at 60 minutes post-birth, and it defined immediate in the first minute of birth. And then the systematic review I found on the Cochrane database also talked about immediate and early skin-to-skin contact, but it defined those a little bit differently. So according to that systematic review, immediate skin-to-skin contact was within 10 minutes, and early was from 10 minutes to 24 hours after birth. And so even though those both varied in their definitions of early versus immediate skin-to-skin contact, they both found that there were no differences in clinical outcomes for early versus immediate skin-to-skin contact. And the randomized clinical trial found that there was no differences in the number of infants exclusively breastfeeding at 6 months or 3 months, or the duration of breastfeeding, as well as there were no differences in weight loss or admission to the neonatal care unit or breastfeeding patterns versus early or immediate skin-to-skin contact. And then the systematic review, it also focused a lot on the benefits of skin-to-skin contact. So it compared that early or immediate skin-to-skin contact to standard birth care, which is when the infant is either wrapped in a blanket or dressed and held by the mom, or in a crib or under a radiant warmer. And so it found that infants who had engaged in skin-to-skin contact on average breastfed for 64 days longer than those who had standardized birth care. And they also found that those who had skin-to-skin contact were more likely to breastfeed at 1 to 4 months old, and their first breastfeeding was more likely to be successful. And that was based on an infant breastfeeding assessment to a score of 10 to 12 and a breastfeeding assessment score of 8 to 12. And so skin-to-skin infants were more likely to successfully breastfeed on their first feeding than those infants who were held, swallowed in a blanket, and held by mom. And they also found that among late preterm infants, they had higher levels of stability. And that was shown by a score called the Scripps score, which stands for Stability of the Cardiorespiratory System in Preterm. So, sorry, that's a mouthful. And so they found that those who had skin-to-skin had higher Scripps scores. And that involves things like heart rate and respiratory rate and oxygen saturation. And so 6 hours post-birth, their scores were higher when they had skin-to-skin. And then blood glucose was also higher 90 minutes to 2.5 hours after birth for infants who had skin-to-skin contact. And then a benefit for both moms and infants, compared with infants who were separated at birth and then returned for rooming in with their mom. Those infants who had skin-to-skin contact with their mothers had better bonding signs. There was more mutual and reciprocal action between the mom and her baby. And between standard birth care and skin-to-skin, there were no differences in neonatal intensive care unit admissions or body weight changes at 14 days. But I think knowing these benefits is so important because for us as nurses, we are the ones who get to educate our patients. So I think knowing these benefits helps us to know how we can explain this amazing practice of skin-to-skin to our patients. And also could be helpful as nurses to implement a standard education program so that every mom learns about skin-to-skin and can know why it's beneficial and then be more motivated to do skin-to-skin. It's also beneficial for us to know it's important so that we can be advocates, to work with other members of the healthcare team to delay unnecessary procedures so that skin-to-skin care can be protected and that special time for maternal-infant bonding can occur. And also, kind of going back to what I saw in clinical, I thought it was so awesome that the moms were asked by the nurse if they wanted to skin-to-skin care. And I think it'd be improved even more if the nurses took time to educate the mothers on the benefits of skin-to-skin care, the infant stabilization, and the bonding, and the future breastfeeding benefits, so that moms are even more informed. So as nurses, with this knowledge about the benefits of skin-to-skin care, we can go out and be more prepared to educate our patients about skin-to-skin care. And also, we don't need to worry if somehow there's emergent care that postpones skin-to-skin care. That's okay. It's still important to do it. And we know that we don't need to worry about the exact timing as much as just doing it in general to have those amazing benefits for our moms and their babies.